So let's review seborrheic keratoses. These are all the features associated with seborrheic keratosis with dermoscopy. Sharply demarcated or scallop borders, white oval structures, the so-called milia-like cyst, the brown oval keratin-filled structures, the comedone-like openings, the linear keratin-filled structures, the fissures, the raised projected areas, the ridges or gyri or fat fingers, the twisted loop vessels, also known as hairpin vessels, and fine vessels surrounded by a halo. Here we have a dermoscopy image in the non-polarized light and near ultraviolet light. And you can see the important features quite clearly. The milia-like cysts, the fat finger extensions, the comedone-like openings. In this case, we see the ridges and the fissures, and we see how beautiful they are in the near ultraviolet light mode. Another seborrheic keratosis, same pattern, sharp borders, comedone-like openings, a few milia-like cysts, as well as some fissures. Here we see the sharp borders, the comedone-like openings, as well as the milia-like cysts. For inflamed seborrheic keratosis, we focus often on the vascular features. And the most important feature are the twisted loop vessels, seen quite beautifully in the near ultraviolet light mode. Another inflamed seborrheic keratosis. Here we see the comedone-like openings, the twisted loop vessels, and if we now enhance this with the vascular enhancer in both the near ultraviolet light as well as in the polarized mode, we see these vessels quite nicely. In this case, subtle features of ridges and fat fingers. Difficult seborrheic keratosis. Both in the polarized mode and the near ultraviolet mode, we see the twisted loop vessels. With the addition of the vascular enhancer, we see these vessels quite nicely. Another tough seborrheic keratosis. In the polarized mode, they almost look like vessels as dots. In the near ultraviolet mode, we see both fissures and sharp borders. And we see the features quite nicely now in the near ultraviolet light mode with the vascular enhancer. In this case here, another inflamed seborrheic keratosis, we see the twisted loop vessels or hairpin vessels. And here with the vascular enhancer, we see them even better. Subtle seborrheic keratosis, we can see some twisted loop vessels. In the near ultraviolet light, if we zoom in on this particular area, you see them quite nicely. Unusual seborrheic keratosis characterized by these ridges and milia-like cysts, seen better in the near ultraviolet light mode. This is a seborrheic keratosis that was traumatized, and you can see the heme collecting. Here we also see the ridges as well as in the near ultraviolet light mode. Unusual seborrheic keratosis. Here we see ridges, milia-like cysts, and it's unusual by the fact that there are some shiny white structures, which is not common. With this inflamed seborrheic keratosis, we see twisted loop vessels and milia-like cysts. And the final case is the seborrheic keratosis with self-tanner application. Here now, you see this yellow color, ridges and fissures. And of interest is in the near ultraviolet mode, we actually see the dihydroxyacetone on the surface of the skin. Thank you for your attention.